Hi everyone, welcome to my channel. In this video, I will be talking about hyperkalemia. In this video, I will be discussing the role of potassium in the body, an overview of hyperkalemia, the different causes of hyperkalemia, as well as the clinical manifestations and nursing interventions. If you found this video helpful, please give it a like, comment below for any questions, and if you want to see more content, please consider subscribing to my channel. So before we discuss hyperkalemia, it's important to first discuss the different roles that potassium has in the body. Potassium is the major intracellular fluid cation that helps regulate intracellular osmolality, neuromuscular and cardiac function by way of the sodium-potassium pump, as well as regulating acid-base balance. The normal range for potassium is between 3.5 to 5 milliequivalents per liter. It's important to note that sodium and potassium have an inverse relationship, meaning that when there is a high potassium in the blood, sodium is typically low and vice versa. If we break down the word hypokalemia, we have hyper meaning high, kal denoting potassium, and emia meaning blood, which ultimately means high potassium in the blood. Hyperkalemia is any potassium level higher than 5 milliequivalents per liter. When it comes to understanding the different causes of hyperkalemia, it's important to note that the causes are either from a decreased excretion of potassium, increase of potassium in the extracellular fluid, or an increase in consumption of potassium. Renal failure is the most common cause of hyperkalemia in that there is an inadequate excretion of potassium due to the abnormalities with the kidney. Adrenal insufficiency is also another cause of hyperkalemia, which goes back to our discussion that sodium and potassium have an inverse relationship. Aldosterone is a hormone produced in the adrenal gland that is responsible for the reabsorption of sodium and excretion of potassium at the kidney by way of the sodium-potassium pump. So when there is a decrease in aldosterone in the body, there is an increase in excretion of sodium and decrease of potassium excretion. Burns and tumor lysis are causes of hyperkalemia because these conditions cause cellular contents to release into the extracellular fluid. And remember that potassium is primarily found in the intracellular space, so when any cell rupture happens, potassium goes from the ICF to the ECF, which increase overall potassium levels. Acidosis can cause hyperkalemia in that the body tries to balance an acidic state by pumping hydrogen ions into the cell in exchange for potassium ions out into the extracellular space, thus increasing potassium levels. Certain medications can also cause hyperkalemia, like beta blockers, which are medications that end in the suffix -olol, as with metoprolol, and these impair the entry of potassium into the cells. Potassium-sparing diuretics like spironolactone or aldactone or ACE inhibitors, such as medications that end in pril, like lisinopril, can cause hyperkalemia since they can cause reduced excretion of potassium at the kidney. A diet high in potassium can obviously cause hyperkalemia, particularly in individuals who use salt substitutes, as these products are high in potassium, which can lead to high potassium levels. When learning the clinical manifestations of hyperkalemia, it's important to keep in mind the role that potassium plays in cardiac and neuromuscular function. As you can see in the diagram, there is a normal depiction of a normal ECG with the P wave, QRS complex, T wave, and U wave. In a patient with hyperkalemia, the elevated potassium will disrupt normal cardiac depolarization, leading to a wide flat P wave, wide QRS complex, and a tall peak T wave. Other manifestations like abdominal cramping and diarrhea are also present in hyperkalemia, as high potassium can increase the hyperactivity of smooth muscle in the GI system. Muscle cramping, weakness, respiratory depression, and an irregular pulse are present in hyperkalemia, as they all connect back to the concept of abnormal neuromuscular function due to an elevated potassium level. If potassium gets left untreated, a patient may go into ventricular fibrillation or cardiac arrest. With nursing interventions, you want to restrict the patient's intake of potassium, and this can be accomplished by teaching them to avoid foods that are high in potassium. Potassium-rich foods are oranges, strawberries, and any green leafy vegetable, and also remember salt substitutes. Removing potassium from the body is also crucial, and this can be accomplished in a few ways. Administration of potassium-wasting diuretics like thiazide diuretics like hydrochlorothiazide or loop diuretics like furosemide can be used in patients with normal kidney function. However, in patients with kidney disease, dialysis may be indicated to remove excess potassium in the body. A medication called K-Xlate or sodium polystyrene sulfonate may be administered, as this medication binds to potassium to be excreted from the body. And an easy way to remember this is that K, denoting potassium, is quote-unquote exiting the body. Another way to reduce potassium from the extracellular space is by administering insulin. Insulin moves the potassium back into the intracellular space, but always remember to administer insulin with glucose due to the risk for hypoglycemia. Because of potassium's huge role in cardiac muscle contraction, always place patients on a cardiac monitor. When a patient is experiencing cardiac dysrhythmias, administer calcium gluconate, as this can reverse cardiac muscle excitability from high potassium. But remember to monitor a patient's blood pressure, as fast administration of this medication can cause low blood pressure. And that is it for the video. If you found this video helpful, please give it a like, and if you want to see more content, please consider subscribing to my channel.